I'm going to be hanging a IV piggy bank. I have gentamicin, 50 milligrams. I checked with my MAR against my doctor's orders, make sure I had the right medication, the right dose, the rate of administration, the right amount, everything like that. I'm checking it for, in my drug book, I'm checking for, make sure it's compatible, the right dose. I'm checking for the rate of administration, the dilution. It says it can go into 50 to 200 milliliters, and I have a 100 milliliter bag. It's the rate of administration is over 30 to 60 minutes. I'll use 60, and it comes out to be 17 drops per minute. It says with this medication to monitor the therapeutic level, which is between 4 and 8, monitor patients with renal failure, maintain good hydration, and serum and electrolyte levels. Okay. So I would make sure all of that is complete. I would check for allergies in the MAR, and I would prepare all my things. I would do hand hygiene before I started preparing. I have my secondary line that had the drop factor on it, which was 10. I would label my bag with the medicine, the dose, my patient, my room number, my date, my start time. I would check my bag for any expiration dates, any cracks, leaks, holes. I would check the solution to make sure it's clear, nothing floating around in it. Okay, so I have I'm going to prime my tubing before I go into the patient's room. Make sure no air bubbles are in. Okay, the top is still on, I'm still sterile. So I have everything ready. Now I'm going to go into the patient's room. I would identify my patient ×2, name and date of birth. I would explain the procedure that I'm going to be given gentamicin, which is an antibiotic. I would check, ask the patient about allergies. I would check my IV site for any redness, infiltration, edema. I would load my bag to check for patency in the IV. Before I started dealing with anything like this, with the tubing and stuff, I would wash my hands. And check that. I would make sure that all this is running good. I would lower my bag and let my IV hang higher. I would clean where I'm going to plug in here. Okay. Now I'm going to make sure it's at 17 drops per minute. I'm going to do it for 15 seconds and then I'll go back for a minute. Make sure all this is open. Okay. Now. on for a full minute, just 17. While it's going, I'm making sure that my IV's 17. Okay, I have it set, so I'm making sure that my IV stays patent, no redness, no infiltration, anything like that. I'm asking the patient if he feels okay, if he's comfortable. Let's see, I have everything done. I make sure the patient didn't need anything. I would let it run over 60 minutes. When it was done, I would discontinue this and restart my primary fluids from what they were originally running. And I think that's all. So to discontinue it, I would just stop the infusion. I can get it off. And it's got everywhere. I would hang this up. Make sure it's turned on. Like I said, set it back to where it was originally. Check on my patient again, make sure he's okay. Check the IV site and go and document.